is that they are going to be discussing this issue by the end of the month. But so far, we've not heard any updates on the matter as yet. What will it take to ensure that all non-citizens who, according to official numbers, make up 10% of the Malaysian population, that they will have free and equitable access to COVID-19 vaccines? Joining us on the show tonight, we have Rani Rasiah. She's the coordinator of the Migrant Workers' Right to Redress Coalition and also the head of the Migrant Desk at Parti Socialist Malaysia. Good evening, Rani. Thank you for joining us on the show tonight. Now,
good evening.
There are those who argue that access to vaccines for non-citizens should be allowed, but only provided only if they pay. Now, do you see a potential problem with this, with charging migrants or perhaps their employers? Could that derail efforts for us to effectively vaccinate the population?
Okay. I think for a vaccination program to be successful, we must get about 70 to 80% of the population immunized, vaccinated. Mm-hmm. And if you take the Malaysian situation, we have at least 6 to, I think you said 10 million people who are non-citizens. So they will come under the 70 to 80%. So if we put hurdles in the way, for example, if we make it difficult for them in terms of accessing the vaccine, then how are we going to achieve our herd immunity? So, and herd immunity is important so that in the long run we do not need the MCO, and the economy can return to functioning as normally as possible. So
Rani, Sorry, go ahead, Rani.
No, so I think the other issue, other point to consider is that we must make it worth the while of undocumented and stateless people and foreign and migrants to come forward and get screened, get tested, get vaccinated. Because actually, if you take like the documented and undocumented workers, they are young, they do not have their families here, and they may not suffer, say, a COVID infection the way a Malaysian would, because we go back to our families and we can infect the more vulnerable people in our families, in the community. So if you look at it from that point of view as well, we must see how we can make vaccination accessible to as many as to the whole population of non-Malaysians as well who are in the country.
Rani, I think the WHO and other NGOs have made the basic principles of public health management very clear. The issue is, I guess, at this point now, what are the practical steps that need to be taken in order to bring on board, especially migrant workers who are undocumented? Because to actually run a vaccination program, you'd have to target them. You need to know where they are. And undocumented workers are, by their very nature, not identifiable, invisible to at least government. And so how do you think government should approach this?
I think they are not visible or unidentifiable because there is such a big trust deficit between the government and this community, because they are always viewed as a security threat, and there are raids against them, and even when there are amnesty programs, they are still targeted. So we don't expect so much cooperation from them. We don't expect them to come forward willingly unless the Prime Minister and other ministers as well consistently tell them that we will, ask them to come forward with the assurance that they will not be caught, they will not be arrested when they come forward, they will not be deported. So there's got to be a moratorium, at least for a year, until the program is completed. At least.
Rani, can you talk a little bit about how to address the trust deficit, especially given what happened previously with the raids during the EMCO? How much of trust building would have to go into this, even if there is a moratorium, or if there is, the idea of trying to vaccinate undocumented workers or stateless people or even refugees, trying to get them to come forward given previous experience with authorities in Malaysia? How much trust building needs to be done?
I think a lot of trust building, and I think all the people in government, the ministers who speak on migrant issues, they have to all speak the same language. They have to reassure this community that they will not be penalized for coming forward. That there is a moratorium, they will stick to it. They have to keep on saying that, and they have to do it. They have to win over the trust.
Rani, is one of the problems actually not just government, though, almost very recently, I think the Minister in charge of Home Affairs said that he wanted to see the military empowered to detain and arrest illegal migrant workers. That aside, do you think part of the problem is that our population itself, Malaysians, there's a segment of us who are not convinced by this, and therefore it's very easy for politicians to raise the security framework in talking about foreign workers. How do we address ordinary Malaysians who don't think that migrants should be treated with care or seen as partners in this fight against COVID?
Okay, I think how do we form perspectives and opinions? I think a lot of it is based on what we read in the mainstream media. It's what our politicians tell us. It's how they refer to migrant workers. Actually, if you look at the migrant community, they are our guests, especially the migrant workers, the undocumented workers, and members of the migrant community who are working and contributing to the economy. So they are often, their contribution is not recognized. Instead, they're always spoken about in terms of security threat. The body language is terrible when you see ministers meeting migrant workers who've just landed in the country. All the migrant workers are seated on the floor, and then you have these ministers, standing over them, and they're not slaves. They're coming here to work. But the way they are treated, the way the kind of language used on them, the lack of appreciation for their contribution, I think, and also there's a lot of comparison between the local workforce and the migrant workforce, where always there's a comparison that migrant workers are, more prepared to work for longer hours, and they work harder and so on, without taking into account the fact that local workers have their families here, they've got different needs, and we are coming from a country that is an importer of migrant labor.
Right.
And so the people here, we are a richer country, we are a richer third world country, and right. we deserve better, we deserve more. The workers here have a right to ask for more, and shouldn't be expected to have the expectations of migrant workers from overseas.
Rani,
so I think,
Rani,
sorry.
What have you heard when you do your work on the ground? What have you heard from them? Are they apprehensive about a vaccine rollout? Do they want to be included? Are they skeptical that they will be included? What have been some of the feedback that you've heard from migrant workers that you've been in touch with?
Okay, I cannot speak too much on that, but I would imagine that as a community as a group of workers, they are younger. They are a certain age group. They are among the fitter ones, and I think in comparison with I mean, as a community, as a worker community, working age community, maybe there is no great, great urgency. I believe. Okay, this I'm not basing on what I hear on the ground. But I believe there may not be the urgency in getting vaccinated.
Rani, if the government decides to charge non-citizens for the vaccine, do you believe that foreign workers, documented or otherwise, would come forward to get vaccinated?
I believe definitely not. And it will work against us as well. It will. Our vaccination program will flop, I think, if we're going to make them pay, for their vaccines.
Rani, finally, what do you see happening in the next couple of months, especially when, in terms of outreach, because the migrant community is also multilingual, it's spread across the country, some migrants actually cross borders, perhaps, southern Thailand, on the Borneo states or territories have a long border with Indonesia. When you think about migrant workers, are you thinking about those kinds of conditions as well?
Okay, I think that's a very, very general question. But I think that this border thing is not a very big issue, I think. The one that is contributing to workers coming in illegally and all that. I think it's more the fact that I think most undocumented workers here are employed. And that is because even the employer community, even the bosses, find a lot of the policies here on migrant labor very difficult to comply with. And the costs involved, they find it too high. So actually our SMEs employ a large number. I think 3/4 of the employees are from undocumented workers. So that's one thing. The other thing is that on the multilingual profile of our migrant workers, I don't think that is a problem. I think the CSOs, the community service organizations, are in a position to help out in that.
Understood. Rani, thank you so much for your time. We really appreciate your insights and you joining us on the show tonight. Thanks. We're going to take a quick break here and consider this. We'll be back with more, so stay tuned. Hi, thanks for staying with us on Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. Let's continue our discussion about what it would take to ensure that migrant workers are included in our national vaccination plan and to ensure that they are successfully inoculated. Joining us on the show now, we have Dr. Tharani Loganathan. She's a public health specialist and medical lecturer at the Department of Social and Preventive Medicine at University Malaya. Good evening, Dr. Tharani. Now, your academic research has focused on migrant health in Malaysia. So I want to begin our conversation with how you think Malaysia should be looking to design its national vaccination program that will be inclusive to migrant workers, both documented and undocumented. What are some of the considerations that you think must be taken into account?
Okay, thank you. Thank you, Melisa and Sharaad, for having me here. It is really important that we get back to the basics. Vaccines are a public good. So for public health specialists, we think of it in terms of providing twofold benefits. They protect the vaccinated individuals from being infected, but also that it provides an indirect benefit to the community by providing the community protection from transmission of infection. So for this reason, vaccination policies are generally designed to be universal. We want to vaccinate a large enough number of population to stop viral transmission. Hence, we can achieve what we call herd immunity. For that reason, it's vital that we ensure that all populations, including migrants, are included in the vaccination program. And Melisa, I say migrant populations and not just migrant workers, because in Malaysia, we have low-skilled migrant workers of something like 4 to 6 million people who are documented and undocumented. But we also have other vulnerable groups like refugees and asylum seekers, about 180,000. And the refugees and asylum seeker groups, I think they would be in the same group as the undocumented workers because they have, since Malaysia does not ratify the Refugee Convention, they are not allowed privileges to work. So they are at risk of deportation like undocumented workers. So these groups are considered vulnerable.
Tharani, if I can ask you about just the practicalities involved in the universality of the application of these vaccines. Malaysians are all well documented. Most of the phone numbers and we leave digital traces of ourselves. But a lot of undocumented workers now, numbering in the millions, as you suggest, don't have that necessarily, right? And so how do you, especially if, say, the vaccine requires 2 doses, how do you make sure that the person who gets the first dose is going to get that second dose, and and so on and so forth?
So, Sharaad, this is very interesting and important question because, as you may understand, undocumented workers, by the very nature, do not have documentation. So, they are not be able to be traced by the government. So, it's really important. What is really important is to build some sort of trust with them and provide an amnesty program. So the understanding should be that what information is provided during vaccination campaigns, so collected by the Ministry of Health, stays with the Ministry of Health, does not go to other government bodies like immigration and will not be used for deportation purposes. So if we provide that sort of amnesty, then we could allow people to come forward without fear.
Right. Well, the other practical issue that's currently being discussed is whether who should bear the cost of vaccinating the migrant population. I mean, there's talk about that with the documented workers for employers to bear the cost of inoculation of their workers. I'm wondering how you're thinking through this issue. If vaccines are not made freely and equitably available to all the migrant population, do you think that the vaccination program can be successful?
Yes, this is a great concern of mine. I think we really need to think about this very carefully because we can consider 3. It's either the government pays, the employer pays, or the migrant themselves pays. Okay, but the government of Malaysia, I think, has a great responsibility to provide vaccination. the thing is, vaccinating this population would actually allow our economy to function back again, because right now, if you can see, the workers in the construction and manufacturing industries are still going to work, and these are the big sources of infection that is seeding the third wave. So if we want our economy to go back, the government would have to do this. They could actually push it to the employers, but you see what has happened with the housing regulations. It's really difficult to enforce housing conditions.
That's a really good point, Dr. Tharani, because I wanted to ask you, what is the point of having, ensuring a successful vaccination program if we don't address the living and working conditions of our migrant population? I mean, yes, we need to focus on ensuring that the vaccine rollout is effective, but how do we also ensure that beyond just inoculating a migrant population, that their living and working conditions are also rightly addressed?
Melissa, actually, vaccination is only one of the things that needs to be done. It's a lot of things. First of all, the living and working conditions really important, because right now things that we are doing is just like fighting fire, and it's the conditions of their living and working that is causing infections to spread. The second thing is actually access to healthcare. So currently, I mean, if you think about especially the undocumented population, they do not want to come to seek healthcare. They only come if someone carries them in, or they're forced into healthcare settings because they fear there's no trust. The third consideration is actually healthcare and detention. Okay, so the migrant populations, especially undocumented, and end up in the prison system or detention camps, which are also areas of concern for the COVID infection. We really need to consider what and how we treat the undocumented population and the refugees, because this group, as you say, they are hidden. We do not have numbers. We only have an idea of where they are going. So, not so easy to tackle.
If I can jump in there, I want to ask you, we set up ourselves a bit of a conundrum, because I believe the Prime Minister says that vaccination will not be mandatory. So if you have a non-mandatory principle operating here, how do you get migrant populations, even if they are kind of well documented within the enterprise or the factory that they work for, how do you persuade them to take the vaccine?
Okay, I actually agree with the Prime Minister's statement that the vaccine should not be mandatory, because, I mean, this is a new vaccine. There might be complications or side effects that may come up. I mean, at this point, there's no evidence of such things, but there would be a slight risk of these sort of things. So it is actually better for people to come in voluntarily, knowing the risks and benefits, weighing that and making the decision themselves. But then again, when you're looking at vulnerable populations, how do you actually force people to do it? This is really an ethical issue. It balances autonomy with how we can get things done. I mean, another way to go about it is to make sure that workplaces have mandatory vaccination, so they have a vaccine passport or something of that sort. But again, I think this will be totally unpopular. The best way is actually to build trust, to get people to come forward, and not to actually enforce any sort of punishment or retribution if they do not do it.
When you say build trust, that seems to me important, but rather abstract. What does the government need to do to build that trust?
Right. First of all, communication. So you cannot be saying, we want to look after you and so on, but then the next moment you say we need to strengthen our borders, to make sure, bring the police out, the army out to catch all the undocumented migrants. So the messaging has to be very careful. And the other thing is amnesty programs. For instance, now the government has got amnesty programs of some sort, but they all involve money and costs, and I guess the track record of the government for providing this sort of amnesty programs are also a bit bad. So those sort of things, it needs to be dealt with very, 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 how do you say, very carefully. The other thing is cost as well. But I think cost, an example for that would be the polio outbreak we had in 2019 in Sabah. And that happened because in Sabah there's a large group of stateless people. And the vaccine prices, the fees for vaccines cost like something like 40 ringgit per shot with the new fee structure. So obviously people wouldn't go in if they have to pay 40 ringgit. Then of course there's always this risk of going into a clinic and getting arrested and detained. So all this sort of things have to go hand in hand. It's not just one size fits all. Yeah, so it's communication and policies at a different level.
Tharani, I mean, considering the severity of the pandemic, and again, maybe we come back to that mandatory question again, the trade-offs. Isn't there a real urgency to get as many people vaccinated as quickly as possible, or am I wrong? Do we have the luxury of time with regard to this vaccination program?
This is $1 million question. I mean, everywhere in the world, there's not enough vaccines. Even if you're in the United States of America, the UK, and so on, who have massive pre-orders, the logistics of it is a challenge. So
okay, so if I could just very quickly interject and ask you, there are those who argue that Malaysian citizens should be prioritized with the vaccines, which, as you pointed out, will come in batches. So who should get it first? Should it be citizens who are lower risk, or non-citizens who have to live and work in conditions that are conducive to outbreaks?
I think we should actually use international, advice. So the WHO SAGE has a guidelines, and it's actually called the Roadmap for Prioritization of Vaccination in context of limited supply. So the first 10% goes to very high-risk healthcare workers, and then the elderly. Then after that, the second phase, that's when you vaccinate people with NCDs and so on, and the vulnerable population. So the vulnerable population migrants are actually in the second phase.
Okay,
so
understood.
Yeah.
All right. Well, Dr. Tharani, we've run out of time. We really appreciate you joining us on the show and sharing your insights with us tonight. Thank you. That's all we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
Thank you so much for watching, and good night.